think the ablation with FARAPULSE technology will reduce our risk of PV stenosis in the long term. And as a previous user or an actual user of the cryo technology, cryoballoon ablation catheters, I think we avoid the risk of phrenic nerve palsy in these patients.
The complication of the techniques with FARAPULSE the rate of complication is very low. With electroporation, you don't have any of these. We have no esophagus lesion. You don't have stenosis of the pulmonary vein. You don't have phrenic nerve palsy because of the specification of the tissue with this kind of energy.
But now the PFA is the game changer probably. I mean, let us see that should be the next step because, of course, we have a drop completely of the complication rate. And that was the reason why a lot of enthusiasm run around this system even before it was available. FARAPULSE show this advantage, and the advantage is that we do not have any more concerning during the procedure because this system is very safe.
So I do not worry about the esophageal fistula, which is a very big difference as compared to point-by-point RF. We do not need to worry about the phrenicus, which is as compared to cryoballoon also a refreshment. And I also, for me it's important that, for example, the volume load during the procedure in heart failure patients, we do not need to worry about.
This is absolutely, you put it on the spot on. This is the advantage of this technology. This is the groundbreaking of this technology. The fact that you can perform ablations without being absolutely scared of damaging the esophagus, getting the phrenic nerve, creating damage to extracardiac structures. This is what makes us so secure when we're using FARAPULSE.
In my opinion, FARAPULSE is giving us the possibility to avoid all kinds of complications with the thermal energy, like, of course, the esophageal injuries. But not only that, we can avoid pulmonary vein stenosis and also the phrenic nerve injuries.
Now, as we know, the technology of FARAPULSE is a technology that is myocardial specific technology, where we only have lysis of the myocytes. And the other tissues, we don't damage the other tissues. We are less concerned about the complications like we were having previously with cryoballoon ablation, like phrenic nerve palsy, for example. We have almost no complication as pericarditis as we have with radiofrequency ablation. I have to be honest, regarding the technology, the level of complication seems to be very low. If we would have any complications, it's not the technology, it's mainly the procedure.
Well, the risk for perforation is less because it's a non-traumatic catheter. Of course, you have to realize that you have an endovascular procedure going to the left atrium, so you have to be careful all the time. But still, the energy form, the esophagus is less sensitive to pulse field, so the risk for fistula and perforation is low. Phrenic nerve seems to be less sensitive, although there are some reports, so we still have to be careful in that area of the right veins. But in general, the chance of complications is much less than with the thermal energy.
As we know, the FARAPULSE catheter delivers an energy that is different from the thermal ablation. It's a non-thermal modality, so it avoids all the collateral damages of thermal energy. So we know that the risk of PV stenosis, esophageal fistulas or phrenic nerve palsy are avoided with this kind of technology.
The good news is I don't worry about any complication anymore when I'm performing my PVI procedures with a FARAPULSE catheter because it has very few of them. For starters, you don't need to worry about the esophagus. We don't use a temperature probe anymore for our PVI ablations because it's not thermal energy, so it's not going through. Then we don't worry about phrenic nerve injuries, we don't worry about pulmonary vein stenosis. So in fact, I'm very relaxed when I'm starting and even when I'm ending FARAPULSE procedure.
two main things, I do believe: PV stenosis and problems with the esophagus. PFA is safe, once more, and effective. I don't have to worry about those side effects, about collateral damage. That gives great certainty and great comfort to the patient and to myself.